Welcome to Ajax, everybody, today. Premier, Minister Fullerton, Minister Bethlenfalvy, our colleagues Lindsay Park and Lauren Coe, Chair Sharon Cochran from Lakebridge Health. It's great to be here today. I have to shout out as well Chair John Henry and Mayor Shaun Collier, to the Mayor and to the Chair and to their councils. Thank you for the leadership that you've shown through the COVID-19 pandemic. All of us in the Durham and the Ajax community appreciate that leadership. Thank you. I am so glad, Sharon, that we are here at Ajax Pickering Hospital, part of the Lakebridge Hospital community. Ajax Pickering Hospital is at the center of our community in Ajax, in Pickering, and throughout Durham. And it's a place that serves our people well in sickness and in health in particular. And we had a chance, and the Premier had a chance to thank some of the healthcare heroes, the workers, and of also the volunteers. So maybe just a quick round of applause for our healthcare frontline heroes and the volunteers that make this place work. Ladies and gentlemen, throughout this pandemic, Premier Ford has talked about something called the Ontario spirit. And that's something that is very much alive and well here in Durham. We'll often, when we talk to the Premier as the local members, talk about it being Durham's time. But there have been many examples across our community throughout the pandemic when we've seen just fantastic outreach. One is the Pickering Ajax Caremongers, which is a group of volunteers who've reached out to provide food and other support for those in need. It's just one of the many, many groups that have supported the community throughout that and has shown that real Ontario spirit, that real Durham pride. And it makes us all proud to be members of this community. Across Ontario, of course, COVID-19 has had a major effect on our communities, and Durham is no different. At the heart of that has been the impact in our long-term care centers. And all of us have experienced through our loved ones the challenges that those long-term care centers have experienced. And the Premier has always said that the buck stops with him, and that whatever the reasons for the situation, and as you know, we have a number of initiatives to make sure that we understand fully the challenges that face our long-term care system and exactly why they happen. But the Premier's always made it clear that the buck stops with him and that action is required. And that is what we are doing today. We are acting. Today, Premier Ford is acting by making an important announcement about long-term care issues in the Durham region and across the province. Durham, for those of us who have loved ones, elderly loved ones in the long-term care system, we know that the wait list in Durham is close to twice the wait list in other parts of the province. So that is why action is important, not just across Ontario, but here in Durham, and that's what we're here to talk about today. So without any further ado, I'm going to turn it over to Sharon Cochran. Sharon, as you all know, is the chair of the Ajax Pickering Hospital of Lakebridge, and has been just a great supporter of healthcare in this region over the long term. So Sharon, thank you for your leadership and welcome to the podium.
Thank you, Rod. Let me just begin is to say on behalf of the Lakebridge Health Board and Lakebridge Health is really pleased that you are all here for this announcement and it's a very important announcement, a collaborative partnership between the government of Ontario, Lakebridge Health, and Infrastructure Ontario. And it will be an announcement of a long-term care facility here at the Ajax Pickering site. It's always, as a chair, one of the things I get to do is I get to welcome everyone that's here. So it's always a pleasure to be here with what I call our Durham Four. They are our Durham MPPs, Rod Phillips, Peter Bethlenfalvy, Lauren Coe, and Lindsay Park. And an extra pleasure to be able to have Premier Ford here today, as well as Dr. Fullerton. I would also like to recognize our partners here today, Shaun Collier, the Mayor of Ajax, John Henry, the regional chair, and our community members from our community advisory panel. We also have, and I'll just give you quickly, there'll be some more introductions a little later. We have board members here, the foundation, our Medical Staff Association, our staff, we do have staff. We have Susan Durick, the interim president and CEO of Lakebridge Health, and Tony Stone, the CEO. I should say the chief of staff. I saw Tony grimacing at me at that point when I made that little mistake, so there we go. I'd like to begin by saying that this collaborative partnership is extremely important to Lakebridge Health. It enables Lakebridge Health's future, a future with health improvements that matter the most, a future with connected partnerships, and a future with an integrated healthcare system for the Durham region. You've heard kind of some stats about the long-term care beds in the Durham region. My only comment is we are among the lowest in the province in terms of the number of beds. And we know from our demographic scans that there will be an increasing senior population. So this announcement is really important to us. 320 long-term care beds. Wow. And I would just say that this is an example of a health improvement that matters the most. Our second future, where we talked about connected partnerships, means that this new campus of care will help us with partners build a seniors center of excellence. Innovative technology advancements, innovative operating models. And our third future with an integrated healthcare system is that the new campus of care helps with the flow for seniors from their home, possibly to transitional care, and then to long-term care. So in conclusion, if I could turn around, I would say thank you to the Premier. This is a very, very important capital build for us. One that's 100% funded by the Ontario government, and it's a huge investment in our region. So just again, my third thank you to them. I think they're probably tired at this point. And then just last, this is an accelerated build. I expect all of you that are here, plus I hope more, in the next 14 months to be back for the announcement of our opening. So just again, thank you very much, and it's my pleasure to be able to introduce Premier Ford.
Well, thank you so much, Sharon, and thank you for the warm welcome. Well, good afternoon, everyone. It's great to be back in beautiful Durham today. I absolutely love the Durham region, and you folks have it all right here in your own backyard. Great people, beautiful scenery, and a strong sense of community. So I'm happy to be here with Minister Fullerton and your incredible provincial representatives, the fabulous four, the Durham four, as they call themselves, Minister Phillips, Minister Bethlenfalvy, MPP Co, and MPP Park. This team behind me are working 7 days a week for the people of Durham. And today's historic announcement is proof that they're getting results. All across Durham, my government is making investments in the region's future. Investments like doubling the size of Bowmanville Hospital with a new patient tower, emergency room, a new emergency room, a new critical care and inpatient units. We're adding 15 more midday go trips and delivering two-way all-day service every 15 minutes along the Lakeshore East GO rail line. This is great news for Durham Region, and we couldn't do it without the help of our municipal partners. My friends, we recently secured a $4 billion deal from the federal investment for Ontario municipalities. This money will support shelters, food banks, public health, and transit right here in Durham and across Ontario. It's just absolutely incredible. And we did it working hand in hand with our municipal partners. They had our back during these critical negotiations, so I thank you for joining us today. We have Ajax Mayor Collier, Durham Region Chair John Henry, Uxbridge Mayor Barton, and Brock Mayor Bath Haddon. Oshawa Deputy Mayor Bob Chapman. Bob, you're an absolute champion. And I know Pickering Mayor Dave Ryan just had surgery and couldn't be with us. We wish him a very speedy recovery. And thank you, Deputy Mayor Ash, for being with us at today's event in place of Dave. I also want to recognize the team here at Lakebridge Health, all the heroic nurses, doctors, personal support workers, and hospital staff. Thank you for going above and beyond to support Orchard Villa and many other long-term care homes in the area. During our time of greatest need, this community, the workers here, you stepped up and you came together, and we thank you. My friends, we will never forget this difficult chapter in our history, some of the darkest days we have ever faced as a province. But when we look back, this period will not be defined by the virus. This period will be defined by the everyday heroes. Those who came together, those who stood together to protect our most vulnerable. Thank you from the bottom of my heart. You guys get You had our backs and we have yours, and that's why we're here today. We're all here today because we care about our seniors. We want our seniors in our long-term care homes to have a safe, comfortable place to call home. It's no secret we inherited a broken system, a crisis decades in the making. We didn't create this mess, but my friends, we're all going to fix it. And it starts with building new beds, new facilities. We're putting forward bold new solutions to deal with the years of underinvestment in our long-term care system. And last week, I launched a new pilot program, a new building model to get more beds built faster for our seniors. We're building state-of-the-art facilities with modern design standards, the best amenities, comfortable and safe places for our seniors to call home. And most important of all, we're doing it in months, which I find incredible. It's going to be done in months opposed to years. And today, I'm thrilled to announce another brand new project to accelerate the building of 322 new long-term care beds right here in Durham Region. That's 320 brand new beds delivered by the end of 2021. That's 320 more seniors who will have access to the care they deserve by the end of next year. And we're so proud to be working with Lakebridge Health, Infrastructure Ontario, and our incredible labor partners to get the shovels in the ground faster and ensure these 320 new beds are built in months, not years. Not only will this project benefit our seniors, but it will create jobs right here in the community. My friends, we are building a better Ontario. We are building a better long-term care system, a compassionate system, a system that puts our seniors first. And as we turn the soil today, we're turning over a new chapter for our long-term care residents and their families. Thank you, and God bless the people of Durham Region and Ontario. Thank you. I'll pass it over to Dr. Fullerton. Thank you.
Thank you, Premier. I am so excited to be here today, and I want to thank Sharon Cochran, Chair of the Board of Trustees for Lakebridge Health, and I want to acknowledge Mayor Collier for being here today, and Michael Lindsay from Infrastructure Ontario as well. And I want to recognize my Durham 4 colleagues, Minister Rod Phillips, Minister Peter Bethlenfalvy, MPP Lindsay Park, and MPP Lorne Coe, who have all been tireless advocates on behalf of their constituents who need long-term care across the Durham region. The shortage of long-term care beds across the province puts added strain on our healthcare system, as thousands of people are currently in hospitals awaiting their next home. The reality is that Durham Region has one of the highest wait times for a long-term care space in Ontario. The provincial median wait time for a long-term care space is 139 days. In Durham, the median wait time is 257 days. Our government is committed to improving this number, and we will continue to work to rebuild and advance long-term care. We remain steadfast in our promise to provide our most vulnerable people with the care they need in a safe and comfortable living space by modernizing the long-term care sector and creating capacity throughout the province. As our government continues to make progress on our broader modernization of the long-term care sector, today's announcement is another example of finding modern solutions and innovative ways of providing the care that our vulnerable seniors need. Currently, it takes approximately 36 months to build a long-term care home once a site and financing has been secured. And through a range of enabling measures such as modular design and construction, rapid procurement, increased construction times to lessen the duration of construction, and the use of hospital lands, we are targeting occupancy of this new long-term care home in 2021. It's important to note that these beds, 320 of them, will be for our vulnerable people to call home. It will be new capacity in our long-term care system. Through innovation, partnership, and modern solutions, our government will continue to improve our long-term care system and create new and modern spaces for our aging loved ones to call home and get the care they need and deserve. Thank you. And now I'd like to invite Regional Chair and CEO John Henry to say a few words. Thank you.
So good afternoon, ladies and gentlemen, and welcome to one of the most amazing healthcare facilities in all of Ontario, Lakebridge Health Corporation. And I know there's a number of health professionals here today, doctors, staff, and the boards of directors of Lakebridge Health. How about giving them all a big round of applause? And I'd also like to recognize Councillor Yamada from the town of Whitby. Premier, you might not know this, but this is an amazing day in Durham Region. We started our morning off with a $2.6 million investment in Parkview Seniors by MPP Piccini, Minister Clark, and MPP Parks were there this morning. So thank you for that contribution. And now we're here in Ajax for an amazing story. So good afternoon. I would like to begin by thanking Premier Ford and Minister Fullerton and Minister Phillips for joining us here today in the region for this exciting announcement. But really, I want to thank you for yesterday's announcement. That was amazing, and it will go a long way to help municipalities throughout all of Ontario. And as one of the fastest growing communities in North America, Durham Region welcomes the addition of this new 325 long-term care beds in our region, and that deserves a round of applause. These new residents will not only enjoy a new state-of-the-art facility, but they will be located on the same lands as one of the province's finest hospitals. And I have to commend Premier Ford and his team on this initiative. They have put a lot of consideration into this project and worked hard to make this a reality for our community. This announcement today is in alignment with the commitment of Durham Regional Council to improve the life of people and businesses in our region through the delivery of essential services, one of which is the delivery of high-quality care within our 4 directly operated long-term care homes. We are pleased that this announcement completes the region's strategic plan, a guiding document that lays out our priorities and sets achievable goals for the short and long term. Taking care of our vulnerable population is one of our top priorities and has always been one for our council. Once built, this facility will allow residents to live in a caring community where people are treated with dignity and respect, where we work to ensure that no one gets left behind or falls through the cracks, a place where quality of life is second to none. a place where we work together alongside our provincial and federal governments to ensure our region continues to grow, families continue to thrive, and our residents continue to say it's the best place in Ontario to live, work, and retire. Throughout this unprecedented pandemic, our community has continued to remain Durham strong, coming together much like all of Ontario to overcome this crisis. On behalf of the residents of Durham Region, we want to thank you once again, Premier Ford, for working together with us to improve long-term care for our most vulnerable. An investment in our people, an investment in our future. Thank you for being here today.
Good afternoon, everybody. Thank you very much for attending today. I'd just like to briefly introduce my members of council. I think I've seen them all here. I have Regional Councillor Marilyn Crawford, Councillor Ashmead Khan, Councillor Rob Tyler Moore, and Councillor Lisa Bauer, Regional Councillor Joanne Dyes, and I thought I saw Regional Councillor Sterling Lee here somewhere. Everybody is in attendance, and thank you very much for coming today. I want to say on behalf of Ajax Council and residents of Ajax, thank you to Premier Ford and your strong cabinet for your leadership in navigating the COVID-19 crisis, for supporting and partnering with municipalities and getting us back on track by investing in critical infrastructure like the long-term care home announced today. We're incredibly excited about this announcement. That deserves a round. Come on. Healthcare is an essential component of the quality of life residents expect and deserve. This announcement will mean better access to not only long-term supportive housing for seniors, but will free up vital space in our hospital for those who need treatment. Our Ajax community is strongly invested in the long-term success of our Ajax Pickering Hospital. Throughout the COVID-19 pandemic response, we saw an outpouring of gratitude displayed every day, from appreciation parades at evening shift change, hundreds if not thousands of donated meals and supplies to the community-wide window project, which saw residents and businesses across town creating posters, putting up mobile signs, and posting videos in support of frontline healthcare workers. Ajax Council has been a longtime supporter of our local hospital, donating $125,000 each year to the Ajax Pickering Hospital Foundation from our non-tax revenues, totaling about $1.6 million to date over the last 20 years. And in addition to the Mayor's Charity Golf Tournament hosted by Mayor Dave Ryan from Pickering and myself, which this year will reach the $4 million milestone for donations to this hospital. I know that I speak for all of Ajax when I welcome this timely development. Co-locating a new long-term care facility directly beside our hospital just makes perfect sense. Ajax has a large older adult and senior population, and our seniors, many of whom have been in Ajax for all of our 65 years, deserve the best care that we can provide. Thank you. But moreover, the entire region benefits from these measures taken to end hallway health care and alleviate pressure on our emergency rooms. New updated facilities for seniors like the one announced today could not come at a better time. I want to thank our local MP, Rod Phillips, for his leadership on this and commitment to Ajax. Our team is committed to doing everything we can to expedite the process and to ensure that this facility is up and running as soon as possible. Now I'd like to invite Minister Peter Bethlenfalvy to come to the podium and finish up. Peter? Thank you.
Well, thank you, Mayor, and I am the last speaker. It's a great day to be here. I want to thank you, Mayor Collier, for those thoughtful words and for your leadership through these extraordinary times. I want to also acknowledge Durham Regional Chair John Henry and Pickering Deputy Mayor Kevin Ash and Pickering Mayor Dave Ryan, who's recovering. Thank you for your leadership as we navigate COVID-19 in the Durham region together. It's also great to be here with my Durham colleagues, also known as the Durham Four, MPP Rod Phillips, Lauren Coe, and Lindsay Park. And finally, Sharon Cochran and Susan Durick and all the great healthcare workers at Lakebridge Health. This doesn't happen without you. All of you. And I do remember doing a motorcade through here, and I remember all the personal support workers, the nurses. We drove around here, and I'm waving and smiling, and you know what they're doing? They're waving and smiling back at me and saying thank you to me, and I'm going, you got to be kidding. You're the ones on the front line. But then I realized we're doing this all together. I'm really, as the MPP for Pickering-Uxbridge, I'm really thrilled that this important project is going forward. I particularly want to thank Premier Ford and Minister Fullerton for joining us here today to share this exciting news, along with others, and I see them up close and personal. These two are working 24/7 to fix the long-term care system, and today's announcement is a testament to that. So thank you for spearheading this community project that will help provide a world-class long-term care health system for our growing population in Durham Region. And I'm so proud of the leadership here at Lakebridge Health, where the staff, the doctors, the nurses, the personal support workers, and the entire team have gone above and beyond these past few months to keep patients and our community safe. Whether it was going in to help defeat COVID-19 at Orchard Villa, or collecting personal protective equipment donations for healthcare workers and distributing them across long-term care homes in the area, they stepped up. Thank you all for showing the true Ontario spirit. Merci à tous d'avoir montré l'esprit de l'Ontario. And merci beaucoup, mon vieux. And today we are taking another step forward to protect the most vulnerable in our community. Et aujourd'hui, nous faisons un autre pas en avant pour protéger les plus vulnérables de notre communauté. Durham Region currently holds the longest wait list, as was mentioned many times, in the province, and so building additional capacity is crucial for our residents. Traditional projects like these can take at least 36 months, but as was mentioned, we're hoping to have it completed by the end of 2021. So I want to thank everyone for coming here today, and I look forward to working with the team at Lakebridge, Premier Ford, Minister Fullerton, MPP Phillips, MPP Coe, MPP Park, and many others to see this project past the finish line. Thank you, and merci.
We're going to go to the phone line for questions. Just a reminder that it's one question and one follow-up.
Hopefully this rain's going to hold off. Thought I saw some lightning go, so let's make it quick, guys. We're
Your
ready.
first question will be from Tim Kelly of Durham Region Media. Please go ahead.
Hi, Tim.
Hi, this question's for Premier Ford. Can you guarantee that the problems we saw at homes like Orchard Villa will not happen in this new home? The Army reported that there were all kinds of issues with Orchard Villa, but can you guarantee to potential family members, potential residents who will move into this new home in a year and a half's time, that they will not suffer from the same kinds of abuses and problems that were so notably reported as happened in Orchard Villa?
Yeah, well, first of all, I want to thank you for the question. I want to thank the folks from Lakebridge Health. I remember getting the call the night the breakout happened with Minister Bethlenfalvy, and people reacted quickly, and it's a real challenge when this virus gets in these homes. It goes through there like an Australian bushfire, and we're doing everything we can to make sure that never ever happens again. We're so much better off than we were 4 months ago with public health. We're better off with Ontario Health. We have millions of PPEs coming off the line every single day, and we were able to structure the temporary workers to stay in one location. So I think we've all learned a tremendous amount right across the province and as a government as well. So we're in much better shape, and we'll do everything we can to make sure that never happens again.
Follow-up?
I wanted to ask on a different topic. A lot of people in Durham Region, especially who drive highways 412 and 418, would like the tolls removed or eliminated on those highways. And there were MPPs elected, like Lauren Coe, who promised that they would be. Is it your government's intention to eventually get rid of those highway tolls?
I'd love to get rid of the tolls, but what we did for the people of Durham, we froze the fees when there was an escalator from the previous government that automatically put the cost up. We were able to freeze them, and our goal is to eventually eliminate them once we pay for the infrastructure and the highways And what I'm going to do is I'll pass it over to the Minister of Finance or Treasury, whoever wants to come up here, and they can answer that as well.
Thank you, Premier, and thanks for the question. What on the specific, and the Premier is quite right. Tolls have been frozen, and the fees have been frozen as part of the initiatives we've taken around making life more affordable across the province, not just here in Durham. MPP Co, in fact, and MPP Park have been working tirelessly on this specific issue, and in fact have asked and are going to be receiving a report that they requested from the Ministry of Transportation on a number of specific suggestions that have been made around the question you asked. I know that report is going to be coming out soon, and I know that they'll be reporting back to the community as soon as they get that. But certainly understand that we know that one of the reasons that the people elected our government, and something that we continue to know is important, is making life more affordable in places like Durham and across the province. And both MPP Co and MPP Park are very dedicated to that and very dedicated to following through once we get the report back from the Ministry of Transportation.
Next question.
From Lorenda Redekop at CBC News. Please go ahead.
Hi, Lorenda.
Hi there, Premier. You're promising more long-term care beds here, but we've heard criticism that first what's really needed is a guarantee of staffing. Otherwise, those horrific situations that we've heard so much about will just continue. So what's your response to that? What is your government doing? And also, what's the status of that commission that you've been promising?
Well, I'm going to pass it over to Minister of Long-Term Care, but we're working with a working group that we put together in February. They should be reporting in by the end of this month. We'll make it public, and we'll also be announcing the commission in the next few days. But I'll pass it over to the Minister of Long-Term Care.
Thank you. So as you heard, the news on the commission will be forthcoming very, very soon. The staffing issue has been front of mind. So as you know, that we were in a crisis going into the pandemic, and that staffing crisis had been decades in the making. And the neglect of the long-term care sector is really profound in the last 20 years. So staffing issues, congestion in our long-term care homes, issues surrounding infection prevention and control, integration with the acute care sector, and I'm tremendously grateful for the hospitals that rose in our call of need to come and help. So going forward, the staffing, the integration with acute care, the understanding of the science behind how COVID spreads, we're still learning about that. We've got health experts through Public Health Ontario, and we're integrating with Ontario Health. And really this has to be a team effort going forward. But many lessons have been learned, and the staffing is a critical piece, as you point out, and we're stabilizing that and innovating, making sure that this doesn't happen again. Thank you.
Follow up.
We've heard from parents of children with disabilities who live in group homes, and they say that first their long absence when they couldn't visit, and then now into these physically distant visits, that it's really having a devastating effect on their kids. So is the province looking to change those visitor guidelines, or would you consider developing an essential caregiver strategy, something that we've heard there's an opposition motion on?
Well, right now our priority is to make sure we protect the kids in those homes, just like we want to protect the long-term care. I know it's tough. It's tough on families, and it's really, really challenging right now, but our ultimate goal is to make sure the people at the homes are protected. I just hate to chance anything and accidentally someone brings the virus into these homes and it goes out of control. You'll be asking me different questions if that ever happened. Why did you do it? Why did you let them in? So we're going to do everything we can to work with the families, and as the numbers go down, we'll loosen up on some of the requirements and protocols. But I understand it's heartbreaking, but our goal is to at least get them in to see their kids. It's very tough.
Next question.
Will be from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. A Newmarket company just signed a contract worth $121 million U.S. to supply 50,000 air purifying respirators to the U.S. government. And so we were wondering, don't we need those respirators? And how is our stockpile looking for PPE? Are we continuing to build it for a potential second wave?
We are on all PPEs. I've been in numerous facilities. We just went by one, Yorkville, that is actually building parts for ventilators. We have over 10,000 ventilators on order, which they're coming off the line right now. We have a stockpile of ventilators within the province. Everyone pitched in. A lot of companies switched over their line, like Lakeview. They've switched over their lines from speakers to Yorkville. I'm sorry, I said Lakeview. Yorkville switched over from building speakers into ventilators. So we're much better equipped than we were 4 months ago as a province, as a people, and as healthcare overall.
Follow up.
And my follow-up question, OPSU President Smokey Thomas has been calling on the government to return the LCBO to regular hours, saying that workers need those hours, and the province is losing tens of millions of dollars every Monday that the stores are closed. So will the stores be reopening on Mondays anytime soon?
Well, first of all, I think the world of Smokey Thomas. He's been a great partner throughout this pandemic, and I appreciate everything he's done. I'm going to pass it over to the Minister of Finance. That falls under his portfolio.
Yes, we are, and we always appreciate the suggestions from Smokey Thomas. He has been a good partner in terms of our operations at the LCBO. At this time, of course, like every other employer, we're looking at what can be done to safely ensure that people can return to work, but also that stores can be open. The LCB has been open throughout the pandemic, but we did reduce the hours, and that was part of wanting to make sure that additional cleaning and safety procedures could be undertaken inside what are very, very busy stores. There has been, and it won't surprise any of my constituents here, there's been a lot of activity, and the LCBOs have been busy, and so we'll be looking at what makes sense in terms of hours, but we're always going to put the workers' safety first, and we're always going to make sure we listen to people like Smokey and their suggestions. Our objective here in Durham, where we moved to stage 3 last Friday, and across the province, is to get everybody back to work, but only when we can do it safely, and then to help get our economy back on its feet.
Last question.
Will be from Paula Loriggio at the Canadian Press. Please go ahead.
Hi, Paula.
Hi, Premier. We are seeing some outbreaks of COVID in areas that have progressed to phase 3, stage 3. And so I'm wondering if you had set some criteria for rolling back areas to stage 2.
Well, not right now. I guess you're talking about Ottawa. I think they dropped a couple points. We're at 111 today, which is pretty good. Nothing's acceptable until you get down to 0. But when we have 14.5 million people, 111 cases, it's great work from all 14.5 million people. Great work from our frontline healthcare workers, and I'm very grateful. But right now, we have to look at every single region. There's 34 chief medical officers that communicate with our chief medical officer, and we really rely on the advice of the healthcare table, and they're doing a good job so far. But I don't think it's anything that spiked too badly. We're still keeping an eye on always on Toronto, Peel, and especially Essex. And my heart breaks for those folks in Essex. Man, they're getting a tough time of it, but we're going to help them try to move into stage 3 as quickly as possible, and we'll have an announcement about all 3 regions tomorrow: Toronto, Peel, and Essex.
Follow up.
Speaking of Windsor Essex, you said last week that you were considering mandatory testing on farms. Has there been any progress in that decision, and what are you looking at in making that decision?
Well, the good news is they're back making sure they're testing on the farms. They have the Agri Center that people can go get tested. We still have quite a few farms to make it to, and I just ask the farmers, which I tell you all the time, I love our farmers, they're great people. And the migrant workers, we're there to protect you, but it's critical that you get a test. It's absolutely critical, and had an opportunity to talk to another premier last night about the same situation, and he's in agreement. I hate forcing anyone to do anything, but we need cooperation. If you go into a country, you should get tested, just out of respect to the country and the privilege of going to any country.
Thank you, everyone.
Thank you, everyone. Really appreciate it. Thank you. Thank you, everyone.
Sorry, please.